Okay, so for this workshop today, we are going to be focusing on communication between families of the patients and patients who are of older age. This will be like an education event, kind of like a TED Talk, but the audience will be more involved and give feedback, unlike a TED Talk. To start off, I'm going to ask the audience, who hopefully is family members who attended this together, what age they think they should talk to their parent about joining their healthcare appointments and just being involved in their healthcare all around. After this, and once people get some time to talk about what they think with their family members, I'm going to ask a few families what they think and why they think that age is appropriate to talk about. After this, I'm going to explain how there's really no age to start talking about parents' health and trying to be involved in their health and going to appointments, because you never know what's gonna happen, especially nowadays, because you never know what's gonna happen. I would say this because, like I said, things can happen at any point, and health choices, especially doing CPR or intubating, can come down on the child or children of the parent that is hurt or sick, and they aren't able to make their own decisions. I think talking about it earlier than most people think would be a good idea, especially with all the stuff that's happening. I would like to mention that it might differ between cultures and religions, because everybody doesn't have the same culture and religion. And bringing that up and getting it into each other's minds, because like I said, some people don't think about that sometimes. I would then ask the audience and the people who are listening to my education thing, if they would want the provider to make all the decisions, the paternalistic approach for their parent or loved one that is sick, hurt, or whatever's going on with them, or if they would want to do the shared decision making model, which is where everybody contributes to the care that is going to be given to the loved one that is sick or whatever. After them picking, I would educate them on the two models, the paternalistic and the shared decision making, going back on our topics in the past week, because I think this is important in every healthcare, with every provider patient interaction, because a lot of times the patient just lets the provider go along and do everything. I would give my opinion on how I like the shared one, because it gets people involved in their own care. And then I'd give the cons of the paternalistic one, which is the patient could feel helpless and worthless, and they feel they can't say anything. I would also explain how, if the family's making all the decisions for the patient might not want what the family does. So here I would bring up the living will or a DNR, which is a do not resuscitate, and these explain what the patient wants to go through and what the patient doesn't want to go through, when their time is there, if they're brain dead, or so to end the workshop, I would have the families get in their groups, and I would have them just talk to each other about what they want and what they don't want. And then I will ask a few groups what they came up with as a family, and have them explain why they came up with this. And once again, I know it's going to be different for every family, and I will explain that, and then I would thank them for coming to my educational event on communication between patients and their families, and when determining what the right time is for talking about being involved in their parents' healthcare. Thank you.